is human immunodeficiency virus, also known as HIV, and my name is Jake Mesa, and I'm here with
Alyssa Escobedo.
Ayana Williams.
And Sophia Ruvalcaba.
going over background information about HIV. HIV is a virus that attacks the body's immune system and also targets the body's white blood cells, weakening the immune system. This makes it easier to get sick with diseases like tuberculosis, infections, and some cancers. It is important to get tested because over 1.2 million people live with HIV and almost 13% don't even know they have it. People with HIV who are not on medication and do not have consistent control of their HIV can transmit HIV through sex, sharing of needles, and breastfeeding. What is HIV biologically? HIV is considered a retrovirus which invades your cells and then uses your cells' machinery to make more copies of themselves. HIV not only uses your cells to make more of itself, but it also inserts its own DNA into your own in its own, into your own DNA. It also affects the body by targeting and weakening the immune system, making it vulnerable to infections. Without treatment, HIV can progress to AIDS, where the immune system is severely compromised and the body struggles to fight off infections. Increases the risk. This also HIV also increases the risk of developing certain cancers such as Kaposi sarcoma and non-Hodgkin lymphoma, which are often associated with weakened immune system. Another risk that comes from HIV is it can enter the brain early in the course of infection. This can trigger an inflammation that may damage the brain, and if left untreated, can cause symptoms that may include confusion, forgetfulness, anxiety and depression, and headaches. Once this infection enters the brain, it can stay there for the rest of the person's life.
Starting off with statistics, it is estimated that around 39.9 million people are living with HIV, and this was at the end of 2023, updated by the World Health Organization in July of 2024. And of this population, 1.4 were children, aged from 0 to 14, and 38.6 adults, which were aged 15 plus years. And also specifically looking at the regions, looking in the right corner, the graph shows 2010, 2022, and 2023, and these are all patients living with HIV. And globally, we can see a slight increase each year. But more specifically, looking at the regions, we can see that in some places medical help is undermined and not as much advanced, and there's no funding for this treatment to help HIV patients and to stop the spread of it. And this also comes in with antiretroviral treatment, shortened for ART. And this treatment has been funded to increase more and help patients to stop the spreading. And as you can see on the chart on the right bottom, from 2010 to 2023, there has been an increase each year and projected to continue increasing in 2025. And this was stated by the National Library of Medicine.
The risk factors and social determinants of the issue. It was recorded that around 83% of people in this study have at least reported one social determinants of health indicator. The education access and quality. Low education attainment on HIV was a factor as well. 17.6% has less than a high school diploma. Healthcare and quality. In the study, it was largely recognized that many would miss health appointments. However, it was mainly focused due to a single factor like transportation, poverty, incarceration, homelessness, and food insecurity. Neighborhood and built environments. Living with HIV, many have reported needing some type of assistance. It was reported that 32% were homeless and 57% were not homeless. Along with homelessness, there was food hunger. 20% did report food insecurity. Transportation was needed, where 31% used some type of needs of transportation or community assistance. Social community context. Social support systems are linked to better health outcomes when being diagnosed with HIV. Having support by attending groups will help encourage for medical treatment and sticking to a healthy treatment plan for his or her partner. Economic stability. According to the social determinants of health and care outcome amongst people with HIV in the US, reported 43% were financially unstable. It was recorded that HIV patients are either barely at income or below the federal poverty limit.
With the ongoing fight against HIV, the vital roles that federal, state, and community efforts play in ending the epidemic are key to overcoming it. One of the key federal initiatives is the Ending HIV Epidemic. The goal is to reduce new HIV infections by 75% by 2025 and 90% by 2030. The focus is on 57 jurisdictions that have high HIV rates. On the community level, we see the critical work of community-based organizations. These orgs are often the first point of contact for individuals who might not have access to regular healthcare. They also provide free HIV testing, education, condoms, and access to PrEP and PEP for individuals who are exposed to HIV. Another state-driven initiative that makes a huge impact is the SSSP. Studies show that people who use SSPs are 5 times more likely to enter drug treatment and 3 times more likely to stop using drugs. While we're seeing progress, there are still challenges we need to address. For example, budget cuts under the Trump administration have posed a real threat to HIV prevention and treatment programs. Consistent federal funding is critical, especially for high-risk communities. Without it, we risk losing the momentum we've gained. Beyond funding, we also need to combat misinformation and stigma around HIV. One of the most effective tools we've seen recently is the U equals U campaign. It is a simple message. If a person with HIV has an undetectable viral load, they cannot transmit the virus to their partners. This is vital in reducing fear and normalizing treatment. We still have a long way to go to challenge the stigmas and myths around HIV.
To conclude, we went over what HIV was and how it can turn into AIDS and the estimated amount of people who are living with it and key strategies to stop it and public health ways to help HIV.